Hey, gorgeous. I want to tell you about one of my newer projects. Taking a facial anatomy course with Dr. Tim Pierce, in which we have a skull, and by using modeling clay, we literally build and recreate every layer of the face, from the ligaments to the blood vessels, eventually the fat pads, the muscle, and the skin. Why? Why do we do this? Why, Karen, do you keep taking courses on anatomy, keep taking cadaver courses, keep going to conferences, keep learning and growing? That's exactly why. I want to be able to provide safe and effective treatments for my patients. Safe and effective. Because you would think, what can go wrong with facial filler? Well, it's very rare to have a bad side effect, but when we do have one, it can be very dangerous. So when we look at the blood vessels and look at the face, the anatomy is very complex and it varies. So I want to teach you about this little guy. This is your facial artery. And when I'm injecting jawline filler to get that nice jawline, get rid of a saggy jowl, create a good angle and shadow, I have to avoid that bad boy. He comes off of your carotid artery. That's the one that we feel when you have a pulse. That vessel comes up and it supplies a blood vessel to the face. If we were to accidentally get filler into that blood vessel, it can clog off the blood supply. The filler can actually travel through the blood vessel system, and in extremely rare cases, things like blindness have been reported. Now, it's very, very, very rare, but it's very serious. So having an injector that's highly educated, continually educating herself for the safety of her patients is so important. Good news, we have protocols in place. So if something like this were to accidentally happen to even the best injector, it can. I have an enzyme that can help dissolve the filler. We're getting an ultrasound soon where we can be able to actually diagnose where the occlusion's at. Currently, we have access to that, which is really nice. But we want to be able to identify these problems if they were to unfortunately happen, to be able to reverse them. So hope you got to see some fun, exciting little anatomy with the blood vessels. And this is just the basic stuff. The blood vessels are numerous and they're everywhere. This branch is like the main trunk of a tree. And as it spreads out, it courses out into smaller and smaller and smaller and smaller vessels. So they're everywhere. You know, we worry about hitting them because we also don't want to cause a bruise. But most importantly, we don't want to see any of these bad side effects. So stick with me. I'll give you some updates as we go along. Next, we're going to look at some facial fat pads because you know those are my favorite things. Thanks so much. Have a great day.